The next thing I want to talk about are laptops and desktop computers. Once again, the issue with the computers is going to be the neck curve and the position of your head. So if you're looking down at a laptop, there's not a lot you can change about that. Laptops are designed the way laptops are designed. However, the desktop computer is a little different. You have a lot more control over what you can do in this situation. When you're sitting at a desk with your desktop computer, you want to make sure that your monitor is at eye level, because if it's not and it's down too low, you're going to be looking down at the computer monitor again, which again is not good for the neck. So you want the monitor at eye level. That's the first thing regarding sitting at a desk with your computer. Now the next thing regarding sitting at a desk with your computer happens to be with the keyboard itself. Often when you're at a computer and you're at a desk, you will rest your arms on the edge of the desk. That's a problem because what can happen is you can begin to induce carpal tunnel syndrome. Now, let's talk about carpal tunnel syndrome. If you don't know what carpal tunnel syndrome is, this is what it is. Carpal tunnel is there are 2 rows of 4 bones in the wrist, making 8 total. Now, they create a little tunnel such as this. Now, what happens is, through that tunnel, all the tendons that allow you to flex your fingers have to go through that tunnel. But what also goes through that tunnel is your median nerve. The median nerve goes to your thumb, the first finger, your middle finger, and half of your ring finger. So if you've ever hit your funny bone and you feel the pain going down into your little finger and half of your ring finger, that's the ulnar nerve. It's the other nerve that innervates the hand. And then that does not go through the carpal tunnel itself. It's outside. It's a very exposed nerve. But the median nerve goes through the tunnel. If this tunnel begins to close up, then what happens is you will feel it in the thumb, first finger, this finger, and half of this finger. It's very specific. Now, what happens sometimes is if you're resting your hand on the edge of the desk, you can actually close off that nerve that goes to your carpal tunnel. And what happens there is that a nerve is hollow, just like an artery is. You can close it off and you get symptoms of carpal tunnel. So just be mindful of that. If you are one of those people who rests your hands on the edge of the computer table, make sure that you put a rolled up towel there or a rubber mat, and that will help soften the area and it won't cut off the nerve going to the carpal tunnel. So those are the main issues regarding sitting at a desk.